Hello friends, today we will discuss about the bacteriology. Okay, so in bacteriology we will be discussing only the cocci, that is about the gram positive and the gram negative cocci. So first here the gram positive cocci, the two important species. One it is in Staphylococcus, another it is in Streptococcus. Okay, so how you can differentiate this is only the test that is called as a catalase test. So catalase test procedure and all you don't want to need. They will just the percentage of hydrogen peroxide is 3%. Okay. So here, so gram positive cocci, you can do the catalase test. If it is positive, it is in Staphylococcus, and if it is negative, it is in Streptococcus. Okay. So now you can identify so whether it is in staph or it is in strep. So if you come to conclusion that it is in Staphylococcus, so how you can further classify it is based on the coagulase test. Okay, so if the coagulase test is positive, it is in Staphylococcus aureus, and if it is negative, it is in coagulase negative Staphylococcus aureus. Okay, so now we will read. So now we will focus on the Staphylococcus aureus. So I will be saying only the important points. So first, in that virulence factors. So every bacteria will be having a virulence factor, right? So here, so first it is an enterotoxin. So it has A to E and G to I. So in that you want to remember the enterotoxin A, it is responsible for causing the food poisoning. Okay. So next it is an So next it is we will discuss about toxic shock syndrome. It is caused by toxic shock syndrome toxin. So here you want to remember one point, that is it is most common in the menstruating women and who are using a vaginal tampons. Okay. So next it is an epidermolytic toxin, and ulcin cytolytic toxin. It has an alpha, beta, gamma and delta and panton, valentin, leucocidin. Okay. So these are the toxins you want to remember here. And there is another toxin that is called as an exfoliative toxin A, and the B that is responsible for Staphylococcus called as skin syndrome. So here you want to remember the toxin and the disease associated with it. Okay. So here enterotoxin A for food poisoning and exfoliative toxin A and the B for SSS, that is Staphylococcus called as skin syndrome. And toxic shock syndrome toxin responsible for toxic shock syndrome. Okay. So next, what is a culture media? So first you want to remember here a nutrient agar will be seeing an oil paint appearance. Blood agar it shows in beta hemolysis, and in gram strain always it is in gram positive cocci arranged in clusters, and Rutland's medium it is in mannitol salt agar. Okay, these are the medium which have been used. And in Staphylococcus aureus, the selective medium is mannitol salt agar. Okay. So next, you can remember like staph. Staph it is nothing but a bunch of grapes appearance, and coccus it is a round shaped bacteria. Like aureus, AU, it is a chemical formula for the gold. Okay. So in nutrient agar it produces oil paint appearance or the golden yellow pigment. So next we will deal with some of the differences between positive and negative. Okay, that is in coagulase positive and negative. So just remember one thing, so it's quite opposite. Here more virulent, less virulent. It forms the golden yellow colonies, and here it is in white colonies, and it is a pathogenic, and these are not usually pathogenic. Okay, so there are two important species you want to remember in the cons. So one it is in Staphylococcus epididymis, another it is in Staphylococcus saprophyticus. So here epididymis it is sensitive, novobicin sensitive, so it is a novobicin resistant. So second point you want to remember here it is epididymis it is a most common cause for prosthetic valve endocarditis, whereas saprophyticus it is a most common cause of UTI in sexually active young women. So what are the resistance in Staphylococcus aureus? It is by two mechanisms. So one it is by production of the beta lactamase enzyme, another it is by alteration of the penicillin binding protein. So here the beta lactamase enzyme it is by plasmid coded, and here so it is an opposite chromosomal coded. Okay. So penicillin binding protein, you want to remember there is an alteration of the penicillin binding protein, that is PBP2, penicillin binding protein 2A, which is mediated by this gene, MECA gene. Okay, again this is an important point. So this completes an important point in the Staphylococcus. So next we will be we'll learn about Streptococcus. So here you want to remember this classification. Okay, so first Streptococcus, it is based upon the oxygen requirement. It is classified into aerobe and facultative anaerobe and obligate anaerobe. So under obligate anaerobe, it is an Peptostreptococcus. So coming for here, you want to remember this important, that is an alpha hemolysis, beta and the gamma. So in alpha hemolysis, you will be dealing with Streptococcus pneumoniae and viridans. In beta, it is an pyogenes, A. galaxiae and equisimilis. So this comes under group pyogenes A, B is galaxiae, C is equisimilis, and here gamma hemolysis, we will be dealing only with an enterococcus. Okay. So here the each and every point is important because they can ask like the Streptococcus pyogenes belongs to which group, means it is an A. Okay. So next, again this is an important slide, the beta hemolytic Streptococcus. That is, okay, one second. The beta hemolytic Streptococcus are pyogenes, A. galaxiae and the equisimilis. So that is usually, see, in that there is we can classify based upon the carbohydrate antigen, that is called as a Landsfield grouping. You can remember like LC. So L for Landsfield and C is for based on the carbohydrate antigen. That is, there is no need A to H and K to V and all, no need. You want to know that this Landsfield grouping is based upon the carbohydrate antigen. That's all. So coming for next, the Griffith typing, it is based upon the M protein. Okay, so just remember these 2 points. So one is LC, another it is an GM. Okay, so now we'll deal with group A Streptococcus, that is it is an pyogenes.